Let us now go to epigastric pain. The topic is dampness in the stomach and spleen, and damp heat in the stomach and spleen. The clinical manifestations of dampness in the stomach and spleen is a feeling of oppression of the chest, dull epigastric pain, dry mouth, no desire to drink, a bitter taste and a sticky taste, nausea, vomiting, and there may also be a frontal headache. The tongue will be red with a sticky yellow coating, and the pulse will be slippery and rapid. This pattern often derives from deficiency of spleen Qi being unable to transform fluids. This pattern is a very common cause of epigastric pain. The treatment principle is to resolve the dampness, harmonize the stomach, restore the descending of stomach Qi, and the ascending of spleen Qi. The points to be used are Ren 10, Ren 9, stomach 21, spleen 9, spleen 6, bladder 21, Ren 12, bladder 20, using the reducing or even method except for Ren 12 and bladder 20, which should be reinforced. The explanation for the points used are Ren 10, Ren 9, and stomach 21 promote the transformation of fluids and stimulate the descending of stomach Qi, whereas spleen 9, spleen 6, and bladder 21 resolve dampness from the stomach and the spleen, and Ren 12 and bladder 20 tonify the spleen to resolve the dampness. As dietary advice, the patient should avoid eating too many fried food, bananas, and peanuts. For damp heat in the stomach and spleen, the clinical manifestations are feeling of oppression of the chest, dull epigastric pain, dry mouth, no desire to drink, a bitter taste, a sticky taste, nausea, vomiting, and there may be also a frontal headache. The tongue will be red with a sticky yellow coating, and the pulse will be slippery and rapid. This pattern often derives from deficiency of spleen Qi being unable to transform the fluids, and this pattern is a common cause of epigastric pain as well. The treatment principle is to clear heat, resolve dampness, and harmonize the stomach. Just like dampness on stomach and spleen, we use the same points, except we add stomach 8 and Li4, using the same reducing or even method, except for Ren 12 and bladder 20, which should be reinforced. We use stomach 8 and Li4 because it resolves dampness from the head and is used in cases of frontal headaches. And the same dietary advice applies, avoiding eating too many fried foods, bananas, and peanuts. Thank you so much for your attention.